So thank you all for joining. Thanks very much. I just want to do a quick check that everyone is here. So we have Pact Care on the speaker. They'll start, and then we have Nuvyta. Sorry, after that, good. Present. Telehealth. These guys here, very good. Medeo, present, and for Arkhn. Okay, well they're lost anyway. They'll just miss the introduction. Very good. Just to repeat the review criteria, how does Fire enable your concept to work? First part, and second, how innovative is the idea? And third is what's the business value? These are the three criteria. Each startup has a 5-minute pitch. We have a bit of time in between then to switch monitors. So put your laptop on here, and then we can ask a few questions in the middle. Good. Then you have your timer ready? You have a timer? Yeah. Set. Good. Okay. Then Andre, you can take it away. Please go ahead.
Sounds great. Thank you very much. Good afternoon, everyone. My name is Andre Fiallo. I'm a co-founder and CEO at Pact Care. And today I'd like to share with you how we're leveraging Fire to improve the way healthcare data is exchanged between patients and their care teams, their doctors and nurses, for the particular use case of diabetes, in diabetes care. So diabetes type 1 is a chronic condition that affects about 3.5 million patients worldwide. It's a chronic condition that is typically diagnosed in very young age and for which there's no cure. So what it means is that patients have to learn how to live with this condition from a very young age for the rest of their lives. And one critical piece in managing this condition is to monitor on a regular basis the levels of sugar, glucose in their blood, so that these patients can adjust their diets, their routines, and to make sure that these values of glucose are in an optimal range. So thanks to advancements in the way these measurements, these sugar levels are measured, patients don't have to prick their fingers so often today. So there's what you see on white, these sensors called continuous glucose monitor sensors, allow these patients to, without pricking so often, to monitor the level of sugar in the blood, in the interstitial fluid of these patients. But collecting the data is just one part of it. The problem is that many manufacturing companies, many companies developing these sensors, they use proprietary formats for the data that they are collecting. And it makes it very time consuming for patients to share their data with their care team, with their doctors, with the physician, which is very important so that these patients can receive feedback in a real-time manner, and they can adjust their routine, their diets. So let me explain a bit more detail about this problem. So these diabetes patients, they have to see their doctors or nurses quite regularly, once every quarter or once every 6 months. But it takes them, for many of these patients, it takes them about 30 minutes just to put down the data in sometimes an Excel sheet, sometimes in a paper sheet, that they then take or send to their doctors or the nurse assistants. And on this side, these doctors and nurse assistants, they spend about 10 minutes just to organize and bring that data from the Excel sheet format or even paper format into their own electronic medical record systems. So this is obviously very time consuming and inefficient and not user-friendly at all. So what we have, our solution consists of two parts. One is a patient interface. You can think of it as a personal health record for diabetes that integrates this glucose data from the different glucose monitoring systems and allows the patient to share their data with their doctor. And that's the second part, the physician dashboard, where the doctor or the nurse will receive the data that is shared by the patient and allows them to have a quick overview of how the patient is doing. In more detail about how this system is, the architecture of this system. So the first step is the data extraction from the blood glucose sensor. For our first proof of concept, we are using the Dexcom API. So this is a RESTful API that uses the OAuth standard for authentication. So we get this data that is generated continuously once every 10 minutes. So one data point every 10 minutes. After this raw data is read by the API, we convert it into a Fire JSON resource. This conversion is done by filling let's say, a Fire observation blueprint with the date when the glucose measurement is generated, as well as the value, the actual value of glucose. So the output of this module is one Fire JSON file per each blood glucose measurement. And these files are then stored locally on the device of the patient that uses it as a patient interface, can see the data can be charted, and the patient can also manage who to share that data with. So if the patient provides the consent, these Fire JSON resources they receive an ID and they are uploaded into a decentralized storage solution. That's what we're using for the backend data management, storage and management. But the data can be then accessed by the physician taking care of these patients. So from the physician dashboard, you can receive all that stream of Fire JSON resources. From the physician dashboard, the physicians can then opt to share that information to their own electronic medical records using a Fire API. So in terms of the business model, so our target customers are diabetes specialists and nurse assistants who can very quickly sign in and onboard patients via an online platform, our online platform, and we charge these specialists €3 per patient per year, which we estimate that brings them about 5 times return on their investment due to the time saving in terms of data entry and data processing. So behind this work, we have a team with very complementary backgrounds from engineering, medicine, and also software development. Thank you very much, and please feel free to get in touch if you'd like to know more about our work. Thank you.
Thanks, Andre. We're slightly over time, but you made it.
Sorry.
Before we cut you off, so that's well done. So please only take this one. I'll just give you that one first. Yeah, I don't think you need anything else. Are there any questions for Andre here? Questions in the room? No, everything here? Oh yeah, there's one. Very good.
Mm-hmm.
Hi, Mikael Rinnemäki from SensorTrend Finland. We are doing pretty much the same thing, so I'm asking whether you have published your Fire profiles, so we could share those and
yes, absolutely. So we have published an article. So we have done some, So there's on JMIR. I can share. Okay, in JMIR we can just. If you see my screen.
No, you're not on the screen anymore.
Okay, so please feel free to. We have published the work that we've done together with researchers from University College London. So you can. The title of the publication is. Designing a distributed ledger system for interoperable and GDPR compliant health data exchange.
And the Fire profiles are in there?
Sorry?
The Fire profiles are in there?
Exactly. So all that information will be there. So feel free to see our published article. And if you have any questions, our contact is there. So I'll be more than happy to follow up on that.
Very good. Thanks, Andre.
Thank you.
Please stay on the call, and then
absolutely
we give it over to the next startup. Locked here, so I don't even know how to pronounce it anymore. No. Nuvyta. Thank you. Okay, Vanya, take it away.
So let me start the presentation. Hi everybody, I'm Vanya and I'm the Chief Technology Officer of Nuvyta. And Nuvyta is a startup we founded in 2018 by a bunch of people with big experience in healthcare domain sector. We implemented the EMR EHR system during the last 15 years. Actually, we designed, developed and provisioned a clinical collaboration platform, multi-tenant, multi-environment, available in the cloud as well as on premises on your own infrastructure, and delivered by a team of a network of certified partners. In our vision, a clinical collaboration platform is more than EMR, more than a clinical data repository. It should be an hospital information system that enables visual customization of processes and workflows, real-time collaboration among all the actors involved in the patient care, and a context-based heterogeneous data visualization. Usability, scalability, and interoperability led us choosing the proper technology and the standards in order to develop this platform. That's why we base our data model on Fire server, and we provide a context-based dashboard interfaces for accessing and manipulating data. A powerful form and workflow designers that maps any tasks and documents to the underlying Fire resources. And essentially, it is a low-code web development environment in which you can develop, design, test, and promote any templates that you are configuring in a Q&A pipeline. So by means of this common data model, every actor, including the patient, of course, can be engaged as an active contributor in the patient care collaborative workflows. With new platform, you can customize processes, work areas, dashboards, and medical records for many use cases. Here, you can see the PPM 2.0 workflow editor in action. You can see all tasks. There can be manual tasks or machine tasks. And here, the form editor. With these two tools, any type of document, referral, medication, or clinical notes can be mapped to the Fire resources underlying, and the narrative generated text template can be defined as well for document persistence. And by means of the dashboard editor, you can get your desired cockpit, such as dashboards for balancing scorecard, administrative ones, as well as inpatient or outpatient work lists. And of course, also custom medical records or patient medical records are around. Here you can see what is under the hood in order to implement this platform. So you see .NET Core 3.0 is how we build all the building blocks of this platform. MongoDB as a persistence layer. We use Redis, Elasticsearch, and Angular for the front end. Here, all the IHE profile that our platform is going to cover. And here, based on our development roadmap, essentially when. And trying to sum up our number. So it's 20 months that we are developing, and during these 20 months, we hired additional 12 people this year. So now we are 18 people. We are going to get 25, 30 people up to next year. We trained 5 partners for the delivery of our platform in a real-time environment, and we have 5 active new platform available in the cloud. We joined IHE Connectathon last year and the Fire Connectathon in Atlanta this year, and this is our second Fire DevDays here. We are a startup, of course, but we had a great boost during last year since we signed a contract with one of the biggest private group of hospitals in Italy. So by the end of 2021, more than 20 hospitals will run our platform in order to get interoperability, and of course they will implement their EHR, EMR system and have it in place in their hospital. Thank you for your attention. I join the event also tomorrow, so I'll be glad to go in deeper details and have live demo of the platform. Thank you.
Thank you so much, Vanya. Well, again, anyone questions? Yep. Very good.
You show the technical roadmap, I think, not the roadmap on feature and the new stuff that you want to add. Is there something on it? Is there missing on your platform that you want to implement?
not only technical, it was related to, yes, in 5 minutes I can get just a few words. So our roadmap, it was split in two main streams. One related to the building blocks, so the workflows and forms and some technical stuff. And the other lines was related to the IHE profile. So in terms of scheduled workflows for outpatient work list, in terms of medication management, pharmacy management, it was all the blocks that you see in that roadmap. So.
Thank you. More questions, anyone? Anything came up? Well, very good. Thank you very much. And I invite the guys from telehealth up to the podium. And let me get this one out of your way. Okay. So.
Thank you.
Yeah, here's your mic.
Oh, great. So good afternoon, everyone. My name is Alan Gaffney. I'm actually a physician, so I feel slightly out of place among all these brilliant technical minds, but I'm going to try to explain from my point of view and from, I suppose, from the Chief Medical Officer's point of view of a company, how fire has been so instrumental in what we do. And then Artur Stawiarski is our Head of Development. If there are any particular technical questions, Artur can sort of help out with those. So basically what we've done is we have really reimagined the patient portal from something that is known at the moment to be basically the hospital telling the patient what they need to know to the other way around. So the patient saying to the hospitals, look, you tell me what I want to know and I will allow you into my platform rather than the other way around. So it's a complete, I suppose, revolution in this way of thinking. Now, I suppose it's always good to bring it back to a patient example. So this is an example of a patient, a girl who is a daughter of friends of ours, but you can imagine it very clearly yourselves if you think about your own parents going to hospital or a child going to hospital. So just imagine this situation for a moment. So you have a 10-year-old girl, she's got severe asthma, she's been in and out to hospital a couple of times, she's got her own asthma doctor who makes sure that she's on all the right medications. And she has things pretty well controlled at home in her own hospital and her own little area. And then her grandparents want to take her away for a weekend back to their place, and it's maybe 100 kilometers away. And unfortunately, while she's with the grandparents, she starts developing shortness of breath and starts getting an asthma attack. So she goes into hospital, and she's seen by a doctor that she doesn't know, and she's admitted to that hospital. So you ring up your parents, her grandparents, you say, you know, what's going on here? And they say, well, look, she had to come into hospital. We're not sure what happened. We're not sure which doctor she's under. We're not sure when she's coming home. And those doctors say they'd like to know some more information about the patient, but they just don't have it. And you can imagine yourself getting very, very stressed by this. You know, you've got somebody in hospital, and it's so often a refrain from patients, nobody is telling us what's happening. So the kind of situation we have here then is we've got a patient in the middle who doesn't have very good connections from the hospital, albeit hospitals are mandated in the US to actually provide electronic communication, but only about 10% of people take it up because the information they get is useless. It'll tell you your height and weight and how much money you owe, but it won't tell you, why you're in hospital and when you expect to go home, and the very simple things. Then, of course, although you're all working on interoperability, in real life, it's very, very hard to exchange information between hospitals. And then the last thing, of course, is that, if your parents have information, they might want to share it with you, or if it's in a child's case, share it with the parents, but there's no way of doing that yet either. So we have looked at a situation where everything is a little bit disparate, and we wanted to bring it all together. So what we've done is we've developed a platform that allows doctors to send very simple WhatsApp messages to patients. They can't send messages back, and that's hugely important for doctors because you can't have this to and fro going on all the time. And even though doctors want to use WhatsApp and have used it in the past, they're really not allowed with HIPAA and GDPR. So now we have a situation where doctors can actually send information directly to a patient's phone. And not only that, that patient then can then decide, I want you to be able to talk to my doctor at home. So they make a connection between them, and then you can get information exchange. And this is where FHIR comes into it hugely. And then the last thing is you want these messages to pop up on the phone of the parents at the same time as well. So we've taken the whole thing and really made it about the patient and not about the hospitals. And so we have an app based on a phone or on the desktop for the doctors, and then obviously from the patient's point of view, it's on their phone. So just on the technical side of things, everything green is within our system, everything blue is outside. So this patient, for example, wants the information to go from one hospital to the other. And I say hospital here, but I mean generically anything, any health clinic or even school nurses or even football coaches and physiotherapists. So you want to get information from one to the other. So we are using FHIR in order to allow those summaries to be taken from other systems, converted into the FHIR format and then sent on to the other hospitals, and keeping that ourselves on behalf of the patient to be sent wherever that patient wants it to go. It's not the only thing we do. We do message translation, patient education, telemedicine and patient surveys, but it's all based on the fact that the patient is at the centre and that we can have this interoperability. We've had really good results. Patient uptake has been about 77% in the hospitals we've gone into. That's way better than the 10% or 5% even in some hospitals. Providers have been hugely into this. They really find it very easy to send messages on their phones directly to patients and find patients don't come back looking for lots more information, or patients don't come back into hospital again because they didn't know what medications to take or whatever. So really good communication. And then the last thing is that patients that do use it recommend it. So we are based in Chicago in the premier healthcare startup there. We run on Google. We have a really good interaction with Trinity in Dublin. And from a business point of view, this makes perfect business sense for hospitals. Patients turn up to appointments when they're meant to turn up. They have better patient satisfaction scores that actually make the money for the hospital. They have less legal fees, and they don't come in within 30 days with problems. So a very good business case for something that we're doing that's very useful to patients. Thank you very much.
Well done. Sounds very interesting. Any questions from the judges?
Yes.
You didn't talk about your business model.
Software as a service. Yeah,
But it's paid by the practitioner.
by the hospitals and the insurance companies, actually. So the insurance companies are the ones that are the most likely to pay for this because they want to make sure that the service for the patients is the best, and they don't want to have to pay for their patients going in and out of hospital. So software as a service, essentially based on the number of patients that are actually using the app with caps on it as well. Yeah.
Very good. Anyone else? Okay.
Great.
Then we invite the fourth.
Thank you.
Thank you very much. You have to remind me again. Medeo. Very good. Medeo, did we already have the people from Arkhn coming in? Very good. You're here. Good. You're after this. Go. Let's get it set up. Very good. Beautiful mountain. There's a few too many desktops. Yeah. Oh. Very good.
Well, I lost mine. Well, anyway.
It's running on there?
Yeah, I think. So, hi everyone. Is this thing working? Yeah? Okay. So, my name is Charles, and I'm the CTO of Medeo, and I'm really happy to be here in Amsterdam to show you what we've been doing in the few past months. So, at Medeo, we've been working on web-based software, so a web-based medical record software for primary healthcare providers. So by primary healthcare providers, I mean general practitioners, pharmacists, nurses, name it. So before diving in, I will introduce you to our company. We were founded in 2016. We are a French startup. Our team is composed of general practitioners and engineers, and our solution is deployed globally as we have clients based in France, but also in India and also in Africa, where we have clients in Morocco, Chad, Niger, and Mali. So, as you know, the use of medical applications and also connected devices in the medical field has brought great advancements to healthcare. So practitioners can access medical applications for medication assistance, teleconsultations, or secure chat, secure mailing. Well, they got plenty of apps. But there is one problem. For the primary healthcare providers, there is no way, there is no applications or no applications to gather all of this data. And in fact, it's even worse. For primary healthcare providers, there is all those applications, they bring a lot of data overload. There is too much information. They spend too much time on administrative tasks to recover those data. So they have to log to a specific platform to get data. They copy it, they paste it in their electronic record. This is a mess. So we know that thanks to FHIR, there have been a lot of works done on the hospital sector. Applications have been, the communications between applications has been made simpler, and this is just the beginning. So at Medeo, we tackle the same problem, but for primary healthcare providers. Let me show you how. We've built a medical record software, and this medical record software is equipped with the best digital services available on the market. And it comes also with connected devices. We build the software, we select the digital services, and we source the connected devices. We then combine them all into one easy-to-use application and easy-to-use platform. So if I put it in other words, the Medeo is a platform that enables practitioners to seamlessly coordinate the patient's care. Here is a small screenshot of our platform. So if you use if you want to make a clinical examination at your practitioner office, then you can use and take advantage of the medical devices in its practice. If he wants to connect or to discuss with other healthcare professionals, he can do that too. I will talk a bit about our clients. So the first part is the one we have in France. This is mainly pharmacists and general practitioner, and we help them discover, navigate, and take leverage the new tools they have access to. In emerging markets, so in emerging countries, we have clients in NGOs, private organizations, and governments. It's around 300 different clients are using our platform, and they all have the same needs. They need to record their patients' data digitally. They need to be able to communicate with each other, and they need to have an interoperability layer. So if I put it, if I sum up, so Medeo's vision is to help the primary healthcare providers to connect their entire environment by the use of digital services and connected devices. So thank you for your time, and if you have any questions.
Okay, very good. Maybe can I start with one question? Like, do you have any paying customers right now?
Yeah, so all of our customers are paying customers, and so our business model is we bundle our medical record software, the connected devices, and the digital service they have access to into one simple monthly subscription. So they pay for the whole bundle.
Thank you. Anyone else? Questions? Okay, if not, then we'll start with the fifth and last pitch from Arkhn. Thank you.
So hello to everyone. I'm Cornelio, co-founder of Arkhn, and it's a real pleasure to be here and to present you our work, especially since what we do aims at serving the entire community. So there's no better place to present it than the FHIR DevDays. And our goal at Arkhn is to make healthcare data more accessible. So you all know about the lack of interoperability in healthcare. But depending on where you come from, things are more or less advanced. So here what happens in a typical French hospital. You have around 100 softwares that were built independently, but they need to communicate data with each other. And the way it's done is that each of these softwares stores data in a proprietary format. And then these databases are synchronized through messages that can be in HL7 v2 or even in FHIR. But this doesn't make your data more accessible when you want to look directly into the database. If you want to conduct a research or anything, it's very costly, and especially if you are a software provider and you arrive at the hospital, if you need to set up all the all the messaging system and to connect to each of these databases, it's a really huge barrier. And more, maybe, well, something that is as important is that there is no clear data governance and that the hospital has no real sovereignty over the data it collected because it is stored in a proprietary format, which it has troubles accessing. And there are some striking figures behind that. In France, for instance, 30,000 people die each year due to adverse drug events, and most of them are related to a lack of communication between services. Why? Because data is stuck in these proprietary databases, and the figures are pretty much the same throughout the world, depending on the population size. When I was talking about the barrier, when you want to deploy your software, it's around 30,000 euros per deployment, and that's partially why half of projects don't make it to production. And you end up with proofs of concepts with which everyone was happy but that cannot scale. And the last figure is the time we all spend cleaning the data and structuring it. And it's really a lot of work that could be done once and for all, instead of doing it every time we have a new project. And the way we do this work once and for all at Arkhn is that we take these proprietary databases, we spend a lot of time structuring them, understanding them, but it's worth it. Because then we put them into a Fire server and we grant access to software providers through an API. And once you've done that, your data is clean, it's accessible, you have a very low deployment cost, you just need to be plugged into to a Fire API, and the data sovereignty is fully in the hands of the hospital. So this morning I presented the way we do this data integration. Tomorrow in the afternoon, Florian Briand, who's one of our open source contributors, will present our Fire server, how we store data natively in Fire, which is very useful when you wanna do heavy computational things like AI. And if you think a little bit about this model, it's a bit what happened without smartphones. We said, okay, let's put the platform in common, the model in common, and that's what you have on your iOS or on your Android. The software editors can focus on their product, and they have a common platform to run their software. And so everything we do is open source, but we are still a company. So what do we sell? Well, we do the data integration as a service for the hospitals who have in return their sovereignty over the data. We provide a cheap access to this data to software editors in order to reduce their deployment costs by an order of magnitude. And then there is the access to the network of hospitals that have been standardized. And one of our co-founders is also a lead developer of OpenMind, which is an open source framework for federated learning. And so you can do things as complicated as training a neural network on several sites, leaving the data on site every time and sending the model once here, one there, one there. And Thomas Walter presented something about this on yesterday morning. He's a co-founder of Lumio, a company we work with on such projects. And it's much easier to have the hospitals to come with you into a research project when you leave the data on site. And so some last words. We deploy this technology in several French hospitals. We are a team of 7 people, and we've opened a position last week. But also everything we do is open source, and feel free to join us to take a look at our GitHub, and we're really happy to discuss about it. Thank you very much.
Very good. Thank you a lot. Questions for the final speaker? I think we have just about 2 minutes left. Questions for any of the other speakers? Anything left? Ah, very good. I will come back to you. There you go.
So I guess my question is, do the devices that you use vary by country? Do you find that certain countries use specific medical devices over another? I know you mentioned these developing countries, and this is, I guess, not necessarily related to a business model or anything like that, but just kind of out of interest.
So thank you for the interesting questions. So yeah, we definitely choose the devices depending on the country. So basically, well, when we sort the devices, we try to find devices that don't communicate over an API, but do it directly via Bluetooth, Wi-Fi, or USB, or you name it. And so it depends on the market. For instance, in India, we know that the patients pay for the health. This is not the case in France. So if the patients have to pay for the connected devices, then we have to find some devices that are cheaper than the one we can provide to practitioners. So we definitely source devices depending on the country and on the type of consumer or the type of users that's gonna use them. Yeah. So we source them, and we well, those are bundled, so they have to take those ones. Or yeah, we don't want to use the devices that like a user will come with a device. This is not the way we do. We sell them the devices, basically.
Okay, then I want to thank all the startups and the rest of everyone attending here. So let's first thank the startups again. And then it's coffee break right now, but later in the day, I don't know the exact time, but we have the prizes. So we'll go in deliberation right now here in the coffee break. If you were not in a startup and you were here, we invite you to join us and discuss with us who you thought was the best startup. So startups definitely go for coffee, and the rest you can stay if you want.